Robert, would you introduce yourself, please?
Yes, my name is Robert Vazzo, and I'm a licensed professional clinical counselor as well as a licensed marriage and family therapist.
I understand you work in the area of sexuality, and especially around the issue of same-sex attraction.
Right, I'm a specialist in this area and also in the area of male sexuality. Right now concentrating a lot on fetishes, but that's correct, yes.
Are you a reparative therapist?
I don't like to give myself a label. I certainly have been trained in reparative therapy. I am a psychotherapist, and there are many tools in my toolbox, and reparative therapy is one of them.
So if you're working with things like fetishes, what role do those things play in terms of sexuality?
Well, interestingly enough, I believe simply that a fetish is any object that gets eroticized, and the purpose of the eroticization is to ward off painful feelings associated with the object. So in a very strange way, I view homosexuality as a type of fetish, where the object happens to be human.
So how do you work to help a person who is motivated to overcome that?
The first thing I do, of course, is take a history, and then what I look for is where is the wound? Where we find the eroticization, we also find a wound. So for example, a colleague of mine had a client who enjoyed being kicked. Okay, he had a foot fetish. And we learned that growing up, in fact, he was kicked by peers and by some family members. And so that gets eroticized, and in therapy, we deal with the underlying feelings below the eroticization.
So in successful therapy, does it mean that the client is always able to identify traumas?
Typically, we find them. The client himself may not be able to identify the trauma because it is buried and is unconscious, but we have many tools to kind of bring those traumas to the surface. And then in that case, once they're at the surface, they can be dealt with.
So what would you say to the critics who would say that you might be on a witch hunt looking for some kind of trauma?
There's no witch hunt. The trauma is there. It's hidden, but there are symbols of it. One of the symbols may be, for example, in the case of homosexuality, an inability to form lasting relationships with males. Or it could be actually an overt complaint about a father who wasn't there, about being bullied. So it's much more simpler than our critics would think.
Would you say something about the outcomes of the therapy? Do people come out at different levels or with different achievements?
It's amazing, Mike. I had a client just a few months ago who only had 5 or 6 sessions with a fetish, and he was finished after that, and told me there was a very sharp decrease in the sexual feelings. In the case of something like homosexuality, because it has its origins in early childhood, it's a little more difficult. Nevertheless, we see good results in the first year of therapy, and often the client in the second or third year is ready to finish.
Are there any therapists or the writings of therapists that have particularly inspired you?
Yes, Joseph Nicolosi comes to mind. He was my clinical supervisor, and he was just amazing. You know, the man is or was a specialist, of course, in the area of male sexuality and homosexuality, but he also had a breadth and depth of knowledge I've never seen before. His training in psychoanalytic and psychodynamic theory is so profound, and his ability to see things that the average clinician couldn't see is just simply amazing.
What would you say was unique about his contribution?
What was unique is that Joseph Nicolosi was not a politician. He was not a modern-day politician. He was a man of facts and arguments, and many of his opponents will dismiss certain propositions that he has without any argumentation. And one thing I just loved about Joe Nicolosi was that if you had a good argument for something, he would listen. And if you were correct, he would tell you. And if you weren't, he would also tell you. That made a lot of people uneasy, but it was just a wonderful quality that he had.
What do you think his legacy will be?
His legacy will be his contribution to the truth about homosexuality.
How was it for you when you heard that he'd passed away?
It's an understatement, but I was devastated. I was in total shock and disbelief. I had actually believed that maybe his enemies had assassinated him. When I heard that he had died from physical causes, I was totally shocked. one of the man's outstanding talents was his ability to teach and also to listen. He was an expert instructor. There isn't a day that goes by that when I myself do therapy that I don't think about him or how he would handle a situation. I've completely internalized all that he's taught me. And I think that, he's planted the seeds for truth to be known. He's planted the seeds for healing. And some people say he was a man who was bigger and greater than life, and I'd have to agree.
So in a nutshell, if you were to summarize, what would you say the main strengths and qualities would have been of Joseph Nicolosi?
One of his qualities was his wisdom, his ability to see things that, of course, other people don't see, and his intelligence in the field. Again, as I mentioned before, he has a lot of critics, but when the critics are put on the spot and asked to refute his theories, they don't do such a good job. So I would say his wisdom and his intelligence.
What would you say to clients who have depended on him or who perhaps were in therapy when this happened?
I would say to them, don't worry. There's lots of us who have been trained by him. There's help out there. He is gone, but his legacy continues, and you need not be fearful.
Robert Vazzo, thank you for your time today.
Thank you very much.